You sent a letter last March, a year ago, trying to make sure that pregnant women were included in some of this research. Why?
Because pregnant women, nursing mothers, are so often left out of the medical studies. And the people we need to protect the most are our mamas and our babies.
Well, first I'm just going to listen.
And we can't do that if we don't collect good data on it.
There are ethical reasons in some instances why pregnant women are not included in clinical trials.
So it's a real problem. Asking a pregnant woman to take an untested drug is obviously something many people will not want to do. And I understand that. On the other hand, if we're not testing, none of the moms can know what's safe and what's not safe. The answer cannot be, we'll just pretend there are no pregnant people out there. We'll just pretend there are no nursing people out there. That's not reality.
Senator Patty Murray compares it to playing catch up.
We have been behind since day one. And instead of being 20 steps behind like regular people and everybody else, pregnant women are actually 100 steps behind trying to ask all these questions. And that's why it's so important we get this research done.
Do you feel like the drug companies, do you feel like the government entities who are working on this are listening to that message?
Well, I think they fail to think of it unless we yell. So I've been yelling.
Some research has begun. Just recently, Pfizer started to enroll pregnant women in clinical trials, and Johnson & Johnson is announcing plans to do the same. But lawmakers like Senator Warren want federal agencies to do more quickly.
We need a CDC that recognizes the problem and then puts real resources into solving it.
Do you think they've done that so far or no?
Not so far. And now's the time for them to step up and do this.
What do you say to somebody who says, boy, Senator Warren, the CDC sure has enough on their plate right now?
You bet they do. Because the CDC's job is to keep us all safe, not to cut out any group.
Senator Murray agrees.
Well, I do know they're overwhelmed. Everybody's asking questions from their own perspective. And no, they've got more work to do to get information out there, especially to physicians and to women themselves. And that takes a lot of work and it takes proactive steps.
What are the next steps?
You know, part of this is whenever you ask a question, the person who hears it is reminded, I better move this up in terms of paying some attention. And that's what both Senator Murray and I are pushing for right now. Move this up on your agenda.
The CDC, in a statement, says it takes this issue very seriously and understands pregnant people may be concerned about the health of their babies right now, pointing out that they, for example, collect data from health departments and are working with outside researchers to understand the impact of COVID on pregnant and nursing women. And overnight, they've actually launched a new online resource highlighting numbers and information in how to enroll in the V-Safe Vaccine Pregnancy Registry. We'll tweet out a link for that on our show account. The FDA says it has taken steps to incentivize and encourage the inclusion of pregnant and lactating women in the development of therapeutics and vaccines, and strongly supports including pregnant women in vaccine clinical studies. If you have any questions about pregnancy, new motherhood, parenthood in the pandemic, we want them. As you know, we are doing our Life After Lockdown series all this week and next right here on MSNBC. Ask us at Hallie on MSNBC. We've got a panel of experts answering them in a segment next Friday you will not want to miss.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.